The Dr. Fazil TV show is brought to you by POYA, People of Yuma Health Association. The Dr. Fazil TV show is intended for health educational purposes only and complies with all the HIPAA regulations.
Hello and welcome to the Dr. Fazil show. This is our August 2020 edition, and our topic for today is going to be severe kidney disease and kidney failure. Thank you, Dr. Fazil, for joining us.
Thank you, Wendy, for having me today. Thank you, our audience, for being with us to watch our show. Wendy?
Yes, thank you. We are practicing our social distancing, so we will not be wearing masks as we are not in close proximity to each other. Dr. Fazil, we're going to go ahead and start right off the bat. And how would a patient know if they had kidney disease?
So, I think the question she's trying to ask, or you are trying to ask, is like, what are the symptoms of kidney disease, or how a patient would know if they have kidney problem? Because a lot of time, if they have gout, for example, they will get joint pain, so they will come to the doctor saying, hey, I got joint pain, and they do some diagnostic testing, and they find, oh yeah, you have gout, and they get treatment. In kidney disease, unfortunately, you do not have any clinical signs or symptoms in the early phases of kidney dysfunction. So that's why we have divided the kidney disease into chronic kidney disease and acute. Acute is short-lived, chronic is long-term, and chronic kidney disease have 5 stages. Stage 1 is normal, stage 5 when someone needs dialysis, and then you have stage 2, 3, and 4, and 5. So up to stage 3, most people do not have any symptoms at all. That is generally diagnosed in the simple blood test known as serum creatinine. And there's a tool available on various websites. It's also available on our website, yumakidney.com. If you go on that website, you will see GFR calculator. GFR stands for glomerular filtration rate. In layman's language, we can call it kidney function. So you just put your age, your gender, your ethnicity, and you have to know the serum creatinine. Normal creatinine is 1 or less. And if you do not know your serum creatinine, you can ask your primary care doctor. Most of the common blood tests do check for serum creatinine. Higher the creatinine means lower the kidney function. So for example, creatinine of 1.4 is not good, 1 is good, 0.9 is even better. So that will give you immediately your kidney function number, for example 40% or 50%, and then on the same page you will see the table which will classify what stage you have a kidney function, what stage of a kidney failure you have, stage 2, stage 3, or stage 4. So that would be the only way to tell if you have a kidney problem in the early phases. And later phases, like for example stage 4 and stage 5, they have different kind of symptoms. For example, they start to have swelling in their legs, they become short of breath, you will feel that you have itching on the skin, loss of appetite, too much sleep or too little sleep, nausea, mental confusion, fogginess, and even stage 5, you can even have a sudden cardiac death, as well as you can go into coma as well. So stage 4 and stage 5 is the one which you get symptoms. Stage 3 and stage 1, 2, and 3, you're not going to have any symptoms, but you will have abnormal blood tests. So my message would be to don't wait for to have symptoms. Make sure that you get your blood test done early enough, whenever you get your blood done, and do talk to your primary care doctor to see if you have kidney failure. And if you're in even stage 2 and stage 3, start intervention rather early, because that's the window of opportunity where you can prevent it and not wait for stage 4 and stage 5, because it might be irreversible. And in stage 5, you will have to have either kidney transplant or dialysis. So that's not a very good option. So I would rather say that prevention is better than cure.
Dr. Fazil, what's the standard treatment for early stages of kidney disease?
So it depends on the cause of the kidney disease. So whenever somebody is diagnosed with stage 3 or stage 2 or stage 4 kidney disease or any stage of the kidney disease, they generally end up seeing a kidney specialist, and then they have a series of tests they do to find the source of the problem. For example, the kidney failure could be due to kidney stones, it could be due to obstruction to the flow of the urine due to enlarged prostate, it could also be due to, for example, lack of blood supply to the kidneys, or sometimes it could be due to inflammation in the kidneys as well. So they have to do biopsies of the kidney, they have to do blood tests. So the answer to this question would be, it depends on the cause. What caused the kidney failure in the first place? Once you know the cause, then you can fix it. So it depends. For example, in the kidney stone situation, you have to remove the kidney stone, and then down the road we have to have a strategy in place to prevent the kidney stones.
So is early stages of kidney disease reversible?
Most likely yes. As we know that when the kidneys start to become advanced, the kidney tissue is replaced by scar tissue or fibrosis. And once you have that in your kidneys, then it would not regenerate and the kidney failure become irreversible.
And what is the standard of treatment for advanced stages of kidney disease?
So if you only have advanced stage of kidney disease, it depends. For example, in stage 4, we have to do a lot of fluid management and diet control, low phosphorus diet, low potassium diet, and less fluid intake in order to prevent swelling in the legs. And sometimes we add certain medications, for example, certain vitamin D supplements, some kind of medication to lower the phosphorus in the blood or potassium in the blood. Sometimes we have to add even baking soda, which to lower the acidity in the blood, which start to build up in the blood as the kidneys start to shut down. In stage 5, when the kidney function is less than 15%, the recommendation is dialysis or kidney transplant. So dialysis could be done at home. We call it PD or peritoneal dialysis, or in the clinic, known as hemodialysis. One or the other that need to be done, or there could be very, very bad complications, including death.
And how long can a patient be on dialysis before they absolutely must have a kidney transplant?
So they can have kidney transplant when the kidney function is less than 21%. So they can actually have kidney transplant even in stage 4. So they don't have to wait till they're on dialysis. But once they're on dialysis, all the transplant centers are required to put the patients on the transplant list if they have no contraindication for kidney transplant, for example, active cancer or advanced age. Then they get on waiting list, and sometimes the waiting list could be up to 5 years, depending on what state they live in and what kind of blood group they have. So it could the waiting time could be 3 to 5 years at this time.
Dr. Fazil, is there a particular blood type that is easier to match for a kidney transplant and move you up on the donor list?
Yes, so blood group type O, if you have blood group type O, then the chances for transplant to get a donor match is a lot more higher than any other blood type. Although they have to do the tissue typing as well in addition to the blood group typing, but that is still better to have blood group type O, because you have a bigger donor pool as compared to other blood types. So yes, so if you have blood group type O, then your chances to get kidney transplant is more, and the waiting time could be up to 1 year instead of 3 to 5 years.
So is it just as simple, if you have the same blood type, then your kidney is automatically compatible, or are there other criteria that must be met?
Well, there are other criteria that must be met as well. Like you have to have a tissue typing as well. But they have a system in place now where if you don't have a direct match to the donor in front of you, they can always have another cross, we call it cross donation. So they can donate the kidney to somebody else this kidney is matched to that kidney, and his kidney is matched to your kidney, or her kidney is matched to your kidney, or the kidney of the patient. And it can do the swap mechanism. They have a computerized program for that, and they can still make it happen.
That's very interesting information, Dr. Fazil. Thank you so much. This is going to conclude our August 2020 edition. Thank you so much for joining us, and thank you, Dr. Fazil, for your time.
Thank you so much for having me in this show today. Thank you for our audience, and stay tuned. I will be back next month with more information about the kidneys. Eat healthy diet, drink fluids, and save your kidneys. Thank you.
Thank you.